Good afternoon. This is Dr. Michael Tapper from Lenox Hill Hospital in New York City, reporting on behalf of Infectious Disease Advisor from the Conference on Retroviruses and Opportunistic Infections, which is just about to begin tomorrow in Boston, Massachusetts. I'm joined this afternoon by Dr. Jared Baeten from the University of Washington in Seattle, the Conference on Retroviruses and Opportunistic Infections, which in fact has moved well beyond retroviruses. There are very interesting presentations coming forth at this meeting, but there's been a lot of attention, particularly since the publication in the New England Journal of an important study in the developing world of the use of the ropilvirine vaginal ring. I wonder if Dr. Jake, you'd like to tell us briefly about that study.
Thank you. So the study that's being reported here at CROI on Wednesday and today in the New England Journal of Medicine was from a study called ASPIRE. This was a study run by the Microbicide Trials Network, funded by the U.S. National Institutes of Health, and it tested in a phase 3 trial with a randomized double-blind placebo comparison the depivurine vaginal ring, a silicone ring that would be placed every month by a woman and removed each month and changed for the prevention of HIV infection. The principal outcomes for the study were to evaluate the effectiveness of this ring for HIV prevention and its safety. It enrolled just over 2,600 women in 4 countries in sub-Saharan Africa: Uganda, Malawi, Zimbabwe, and South Africa. And women were followed every month with HIV counseling, testing, risk reduction, and replacement of the ring. Average follow-up was about 18 months, and the longest follow-up was just under 3 years. In total, 168 women acquired HIV during the study. But the 168 women acquired HIV during the study. 97 women who had been assigned to the placebo ring and 71 women who had been assigned to the active depivurine ring, translating into a 27% reduction in the risk of HIV acquisition offered by depivurine, a result that was statistically significant. In a number of additional analyses that were done in the study, it was demonstrated that in subgroups of women who had higher adherence to the ring, HIV protection was even greater. And this was quite substantially seen in women who were 22 years of age and above, in whom HIV protection was 56%, a result that was highly statistically significant. The ring was safe, with no suggestion of either minor or major side effect differences between women who had been assigned the depivurine ring or placebo. So in sum, this phase 3 study demonstrates that a monthly ring containing an antiretroviral called depivurine can reduce HIV acquisition in women by a third overall and by more than half in women who use it better. These results are an important step forward for the development of new prevention options for women, particularly for the settings where the study was done, where HIV risk is quite high.
From a historical point of view, we can go back to the original tenofovir gel, which was promising but had some disappointing results as well, to the VOICE study, which looked at a variety of methodologies. Where would you put this study in the context of our previous studies and our previous attempts to find a method for women to adequately control the prevention methods for HIV?
You make a really good reminder how we should look back and see where we've come from. The last few years have seen tremendous advances in HIV prophylaxis using tenofovir, predominantly tenofovir-based pills, but at the same time, tremendous challenges with several studies, all in women in sub-Saharan Africa, demonstrating no HIV protection effect. Principally because women weren't unable to use the products well enough to achieve HIV protection. With this study today and the ring study that's reporting its results as well, we have 2 studies of the same product replicating results showing that women can achieve enough adherence to achieve statistically significant HIV protection, and protection to a pretty important degree, more than half of women who used it best.
You come from the University of Washington, which is well known for its work in STD prevention. So moving us away from the simple issue of prevention of HIV acquisition, would you want to talk a little bit about where this leaves us in terms of other infections such as herpes simplex, other potentially transmissible genital infections?
The development of effective prevention strategies that work for women and are workable for women opens the door to developing multi-purpose strategies that can protect against HIV, pregnancy, so act as a contraceptive and an HIV prevention agent at the same time, or HIV and other STIs. So this ring and this technology of using a ring for HIV prevention in women allows for the development now of new multi-purpose prevention technologies, including things that might be able to prevent against sexually transmitted infections as well as HIV.
So one last question has to do with the issue of HIV viral resistance. This has been a question that's come up since the beginning of the studies. It's come up in terms of some of the tenofovir PrEP studies. What was the experience in these studies that you've talked about with the evolution of HIV viral resistance?
So the question is an important one for any prophylaxis strategy using antiretrovirals. In this study, as well as in the ring study that are reporting their results this week, there was no difference in the rate of antiretroviral resistance for women who acquired HIV in spite of being assigned to the dipivering ring compared to those who acquired HIV and who had been assigned to placebo. Very reassuring that the ring does not select for antiretroviral resistance.
Very interesting, very exciting, and a real breakthrough, hopefully, for the less developed world where breakthroughs are still urgently needed.
Thank you, absolutely.
Thank you.